Assalamualaikum and a very good morning to the respected judges and audience. I'm Khairun Nisa, and let me start with the background of our research study entitled The Practice of Hand Hygiene Among Dental Students, a small matter yet of paramount importance. Hospital-acquired infection is obtained by patients after the admission to the healthcare facility. It is one of the major concerns that causes increase in morbidity, mortality, and healthcare costs among hospitalized patients. In 2001, one of the tertiary care referral hospitals in Malaysia spent 1.98 million ringgit Malaysia only on antibiotics to treat HAI. In fact, healthcare practitioners have been identified as the most common vehicle for HAI transmission. Dental health personnel especially are at high risk of exposure to the infectious diseases that colonize oral cavity and respiratory tract. Moreover, the new strain of coronavirus or COVID-19 has been declared as global pandemic and still ongoing recently. The virus is most likely to spread in small droplets or direct contact with infected person. Hence, both HAI and COVID-19 have been a stark reminder to all of us regarding the importance of infection control measures. In 2005, World Health Organization has launched the first global safety challenge to promote hand hygiene at all levels of healthcare. It has been appointed as the leading preventive measure to reduce the risk of infection transmission among healthcare facilities. Previous study documented unsatisfactory levels of knowledge, practice, and attitude towards hand hygiene among undergraduate students. However, there is lack of recent study regarding knowledge level of hand hygiene and the practice of hand hygiene in clinical settings among undergraduate dental students. Thus, it is crucial for our study to be carried out in order to address our objectives, which are to decipher the knowledge level of hand hygiene, assess the practice of hand hygiene, and also to identify the correlation between knowledge level regarding hand hygiene and their practice in clinical settings among undergraduate dental students. Moving on to methodology, this is a cross-sectional study. All students from year 3 to year 5 UiTM undergraduate dental study were recruited, so no sampling methods applied. The first research tool was self-administered questionnaire that was validated by WHO. It consists of 10 questions. The answers to these questions were multiple choices of yes or no options, which each correct answer was given 1 point, and incorrect answer was considered as 0. The maximum obtainable score for knowledge was 25. The scores were calculated and then expressed in percentage. An overall score for more than 75% was considered as good, 50 to 74 was moderate, and less than 50% was considered as poor. The second validated questionnaire was adapted from research paper Knowledge and Practices of Hand Washing Among Health Professionals in Dapti Referral Hospital. It consists of 10 questions and assessed as poor or good practice hand washing. The options given were never to always, and respondents who respond the practice question with more than 50% in line with the recommended hand washing practice was considered as good, while less than 50% was taken as poor hand washing practice. IBM SPSS version 25 was used for data management and statistical analysis. The knowledge level regarding hand hygiene and the practice in clinical settings were analyzed by descriptive statistics to obtain frequency and percentage. Lastly, presence correlation analysis was used to determine the correlation of knowledge level regarding hand hygiene and the practice in clinical settings. Next, for results, a total of 252 submitted questionnaires was submitted, giving a response rate of 100%. Based on the data analysis, dental students showed high level of knowledge regarding hand hygiene. As you can see in figure 1, the ring chart shows majority of the respondents, 74.6% showed good knowledge level, while 25.4% had moderate knowledge level. Next, for figure 2, the pie chart represents all respondents showed good practice according to the recommended guideline. And knowledge level regarding hand hygiene was found to have a negative weak correlation to the practice in clinical settings with a R value of negative 0.354 as plotted in figure 3.
Hi, I am Nabilah Hanis. I'll be moving on with the discussion. In this study, undergraduate dental students were reported to have a high level of knowledge regarding hand hygiene. The reason for this can be attributed to the teaching and learning activity from the Introduction to Clinical Practice ICP module, just before they enter the clinical training. They were taught regarding hand washing technique and how to don and doff personal protective equipment, PPE. The result in this study is in parallel to a study done in northwest Nigeria, which recorded about 3/4 of the respondents exhibited good knowledge of hand hygiene. On the contrary, a study conducted in Navi, Mumbai has revealed only 7.59% of the respondents had a good knowledge, while majority of them, 69.19%, was moderate in knowledge regarding hand hygiene among medical, dental, and nursing students. Next, practice of hand hygiene, which is our second objective in this study, depicted that all respondents had a good practice. The result of this study demonstrates that dental students were aware that hand washing plays a significant role in preventing the incidence of hospital-acquired infection. In a study in Nigeria, it was revealed self-reported good hand hygiene practice was found among half of the respondents, which is 56.8%. However, this result contradicts a study in Northeast Ethiopia among healthcare professionals that revealed more than half of the respondents, which is 56%, were categorized under poor practice. Although there was significant linear correlation between knowledge and practice observed in this study, weak correlation was found between level of knowledge and practice. This study revealed a weak negative correlation due to inconsistency in both knowledge and practice of hand hygiene level. For example, a few samples were found to have a low knowledge score but high practice score. This result contradicts a study done among South Asian medical students, demonstrated that knowledge has weak positive association with practice. And they reported those with higher score on knowledge and attitude will also score higher in practice. Moreover, research done by Noorjamal among healthcare professionals recorded surprising results which revealed the participants had poor practice of hand washing, despite that most of them were knowledgeable. So, improving knowledge may not necessarily change their practice. Nonetheless, this is a very interesting research question to be addressed for future studies. In order to understand the reason why students who possess high knowledge on hygiene measures do not implement it in daily practice. Overall, results of this survey show reasonably good responses toward knowledge and practice of hand hygiene. There are several limitations which needs to be considered in this study. Firstly, the response were based on student self-assessment as it may not fully reflect students' real knowledge and practice of hand hygiene. In addition, the number of questions also do not represent the real knowledge level and practice of the respondents. Moreover, there is a possibility that students did not realize the negative question as it can lead to inaccurate answers. Lastly, the result could be biased and did not represent the dental student from all universities in Malaysia. I'll be moving on with the conclusion, which is the last part. Level of hand hygiene knowledge slightly influenced the practice of hand hygiene in the form of negative correlation. Although respondents had a good knowledge, there might be external factors which influence the practice, such as attitude or environment. This can be seen by a study by Trigueros, which addressed determinants including knowledge, facilities, and attitude as the valuable components in hand hygiene improvement strategies. Hence, further qualitative study should be conducted to elucidate other confounding factors influencing the practice of hand hygiene among undergraduate dental students. Below is our references. Thank you so much.